the meeting tonight in a very special way. In Jesus' name, amen.
Well, it's good to be back in Fallbrook. It's been, I haven't calculated it out yet, but it's been many years since we were here before. But glad to be with you this evening. And what we're going to go over, and I appreciate that prayer, is, I think, evidence that God really wants people with mental illness to recover. And he has given a lot of good information through inspiration and science so that depression and anxiety and other mental illnesses don't have to be struggled with for life. They actually can be eradicated and they can be taken care of, and we'll see some pretty solid evidence of that during this weekend. However, mental illness is at an all-time high, at least in America. And during the COVID pandemic, there were really two pandemics going on. There was one the news media was focused on, and then there was the mental illness pandemic. And the mental illness pandemic skyrocketed depression and anxiety. And unfortunately, there hasn't been a recovery. The COVID pandemic's over with, but the mental illness pandemic has not subsided, and it continues to move forward. So the psychiatric Bible, we stick with the definitions that psychiatrists and other health professionals use. The DSM-5 tells us there's 9 diagnostic hallmark symptoms of major depression. You don't have to have all of these in order to have depression, but you have to have 5 of 9. Deep sadness or emptiness. Most people, when they say I'm depressed, they're actually saying they have that deep sadness. Men they can get the deep sadness as well. Women tend to recognize it more because they'll get into crying spells. Men can also have crying spells, but not as frequently, so it's not normally noticed. And when men feel empty instead of sad, they don't go and seek for medical help. And it's one of the reasons why women tend to be more diagnosed than men. The men that sometimes I diagnose depression on, they kind of deny it because I'm not sad. You don't have to be sad in order to have the clinical diagnosis of major depression. Apathy, this is very prominent as well. This is when you wake up in the morning and you're not excited about the day. You get up out of a sense of duty and responsibility, but not because you're interested in the day. And that can happen to anyone once in a great while, but when it happens the majority of the time, that is distinctly abnormal. And so interest can go down considerably. Things that used to be pleasurable, no longer pleasurable. This third one, sometimes you need to check with your relatives on. I've had many discussions where I'll say, are you more irritable than you used to be? And they'll say no, and then the person that's with them over there in the corner is saying, oh yes, they are. and then I'll say, your spouse just disagreed with you, and they'll turn around, what do you mean? And they will tell stories about what happened in the last 2 weeks of how they flew off the handle in ways that they didn't used to do that. And then they'll turn back to me and say, all right, I guess she's right. I guess I am more irritable. Also, when we slow down, psychomotor retardation, we tend not to notice that either. In either an increase or decrease in weight or appetite, which is more common, weight gain or weight loss? Weight gain is more common. Why is it more common? That's right. We can self-medicate with food to try to make ourselves feel better. And what food or foods tend to be the most prominently utilized by people in depression? Yeah, it's the sugary foods or the high fatty foods. And we'll never solve the obesity epidemic in our society until we solve the mental health issues behind it. And often we just focus in on the obesity, but there's mental health issues behind it. But you can also suffer from loss of appetite and weight loss, particularly if it's sudden, severe onset, or anxiety symptoms often are associated where it can even hurt to eat. You can get nauseated and you can have loss in weight. So in our program, we'll have people that are underweight and we'll have people that are overweight. Now, not everyone falls into either the decrease or increase. As mentioned, you don't have to have all of these symptoms, so we have people that are normal weight as well. But interestingly, in our program, the people that are underweight will all gain weight, and the people that are overweight will all lose weight in the same program. Because, of course, we're dealing with the underlying mental health issues behind it. Sleep disturbances. In our program, 90% of people that come to us have sleep disturbances. What is more common? We have individuals that have come to our program that are sleeping 20 hours a day, barely awake long enough to survive, to stay nourished and to stay clean enough to survive. So hypersomnia is also pretty common. There's people that just want to sleep all the time. By the way, that woman that was sleeping 20 hours a day, 3 of the 4 hours that she was awake, she was in her bed directing her family from her bed, not even getting up. So she was only up for about an hour out of those 24. But since coming to our program, she only sleeps 8 hours a day, and she's got energy, and she's totally revitalized. So, and it can happen even in younger people. We've had college-age kids that are high IQ that have, gotten even scholarships in Ivy League schools and then not able to perform because of their hypersomnia. They're just having to sleep. In that case, recent case that I'm thinking of, they were sleeping 13 hours a day. So they had 11 hours of being awake, but when you have a full load in college and you have to do all of that, it's pretty challenging. And so as a result of the academic challenge of the hypersomnia, the person didn't even recognize that the reason for the hypersomnia, they were going to a sleep specialist, a neurologist, and the neurologist was just saying, well, didn't notice that connection with depression. But clearly, when we did these diagnostic hallmark symptom workup, clearly the individual was actually having depression. Decrease in focus and concentration. This is when you are reading something interesting to you, you get to the bottom of the page and you realize you forgot what was at the top of the page. And you have to go through it again, and maybe even the second time, I missed it again, and you have to go back. That is significant check mark there in the decrease in focus and concentration. Fatigue. We talked about how interest can go down, but energy levels also can go down. And you may wake up with not enough energy or run out of energy too early in the day. And then feelings of worthlessness. This symptom is a sign of severity. Individuals with depression, obviously, if they have any ability to be of use to themselves or others, they're not worthless, but they will be convinced that they are. They will actually be convinced that their families would be better off without them and that they would be better off dead. Irrational thinking. So along with depression always comes irrational thought. Same with anxiety. Both of them are characterized by irrational ways of looking at things. Morbid thoughts. This is where you are thinking you'd be better off dead, or you're just preoccupied with death or symbols of death. So you don't have to have all of those 9 symptoms, just 5 or more, and that's major depression. But if you have 2 to 4, that's minor depression, and it's only considered normal if you have 0 or 1, as long as the 0 and 1 are not the last 2 symptoms. The feelings of worthlessness and morbid thoughts are always abnormal. Anxiety disorders. also tend to come with depression. In our program, in our residential program, 80% of people with depression will also have anxiety, and vice versa as well. So they're really kind of, the DSM treats them as separate, but in reality, we find it's the same brain chemistry issues. They're really part and parcel of the same manifestation of the mental illness. And anxiety disorders, when we add them all up, are even more common than depression. Now, if we just take a look at major clinical depression as a single diagnosis, that's the number one mental illness. But if we look at all the different forms of anxiety disorder, there's more anxiety than there is depression out there. Feeling on edge, racing thoughts. Of course, the primary symptom is excessive fear and worry about a number of things. PTSD is actually an anxiety disorder. We're seeing that rise significantly. Social phobias are at an all-time high. It's amazing how many young people today have social phobia. They'll come to us, they're at a university, they will go eat in the cafeteria, they'll take the food back in their room, they don't want to be seen, they don't want to have to relate. Now they can relate on a text message or on an email, but face-to-face social interaction, too much because of that social anxiety. And one of the things that's driving it is also something known as social appearance anxiety. Social appearance anxiety is the thought that as soon as you are viewed, you are going to be judged negatively by others. And many young people have that social appearance anxiety. And one of the things that, of course, drives it is social media. Because, this friend of theirs posted a picture where they look very stunning, and the individual thinks, I'll never be able to measure up. If people see me, they're going to judge me negatively. And they don't realize that person that just posted the stunning picture doesn't look like that either. They took 1,000 pictures of themselves to find the one that looked least like them, and then uploaded it to that social media site. And so we're kind of comparing among a very false world, per se. And our young people, that's the area they live in. And studies have shown the more you are on social media, the more antisocial you become as far as face-to-face social interaction. But there's other things that can drive it as well. Panic disorder is an anxiety disorder. We're seeing that go up as well, where you just have these physical symptoms where you think you're having a heart attack, or you can't breathe, or abdominal pain, and go to the emergency room and there's nothing that they can find that's physically wrong, and then they realize this is a panic attack. And then there's other host of physical symptoms of anxiety disorders. Chronic pain often is due to anxiety. We've had so many people diagnosed with all sorts of chronic pain conditions, and halfway through the program they're throwing their pain medicine away because we have now solved the anxiety issue behind the pain, and they're not needing that pain medicine per se. One of the other evidences of the rise in mental disorders is taking a look at the proportion of the population reporting self-harm. The ones that tend to harm themselves the most in today's world are 16 to 24-year-old girls, but it can happen even in older people. We had a woman come to our program the other day. She's 70 years old. She had never self-harmed before, but with her mental illness, she actually started to self-harm at 70. So it can occur really at any age. But in 1993, 1% of girls were self-harming. 2000, this is actually, I'm sorry, this is not correct. It should say 2%. I'm not sure. I copied this over from another presentation, but it's 2%. And then in 2007, it was 4%. So what do you think it was in 2014? Well, you'd think if it's exponential, it's going 1, 2, 4, and then 8, 26%. And they didn't look at it in 2021 because of the mental illness pandemic. It was so high, and they thought, well, this is probably not right to look at it during the pandemic, but I can tell you it was It's been higher than that as well. And this isn't an attempt on someone taking their life. It's just that their emotional pain is so severe that they want to be distracted by physical pain. And of course, as you cut yourself, it's very physically, you notice it. And it is, it distracts them from their emotional pain, and then it sets themselves up for an addiction. And so in every one of our programs, we will see the scars on young individuals as they have been mutilating themselves, and sometimes older individuals as well. Well, depression and anxiety would be bad enough if it just caused those symptoms, but studies show that it shortens life, increases your risk of a host of physical problems, and even death from non-physical disease, such as suicide. You can increase your risk of accidents, etc. We won't go into all of that, but the cost of depression financially is also significant. Children or adults who suffer from depression have lower incomes, lower educational attainment, fewer days working each year, and depression leads to 7 fewer weeks of work per year if you are working, loss of at least 20% in lifetime income, and a lifetime loss for each family who has a depressed family member of $300,000. That data is 15 years old, so we now know it's even more than that. And so, but a lot of people won't get help. In fact, the best help that they could get, because it might cost a few $1,000s, but it'd be the best investment you could make to spend a few thousand and make it up on the other end. And we've seen that happen over and over again. Vast majority of individuals that come to our program that don't have money, that borrowed money, are able to pay that back and do far better financially within 1 year of coming to the program. So, and fortunately, some of the cost, for the typical person, if they, we have a community-based program as well. I don't know if the Fallbrook Church, did you ever run the community program here? Didn't run the community program. But, oh, you did? Okay. So the community program is very inexpensive. It's less than $200. You get a lot of material for it. And it's just a mental health education program. And the majority of people will have a significant clinical response. In fact, the majority of the people during the 8-week program, when we do pre and post results, over 50% of them will actually no longer qualify as having depression and anxiety. So that's very low cost. But some individuals, if you're sleeping 20 hours a day, obviously you're not going to go to a program like that because you can't make it. And then there's other individuals that it's just too challenging for them to be able to do the types of things we're going to be recommending here today to help with depression and anxiety. And that's when they need to go to a residential program where we can help guide them through that process. Now, the number one treatment for depression today is what? It is medications, well known. In fact, these medications are the number one class of drugs sold in America today are now depression and anxiety drugs. Let's talk about how they work. Now, on the left-hand side there, those green molecules are serotonin molecules. And of course, to make serotonin, you have to have tryptophan, you have to have carbs, you have to have the right B vitamins, you have to have some brain energy. It takes 1 million ATP molecules to make one of those serotonin molecules. And you have to make it in the brain. The serotonin you make in your gut doesn't even cross the blood-brain barrier. It doesn't go into the brain. And so we have to have those manufacturing plants working. But there might be an issue. Maybe the person isn't on enough, it doesn't have enough B vitamins. Maybe they have a genetic issue where it's hard for them to methylate. Or they're not getting enough light. We need light to be able to make serotonin. And so depression symptoms can start to develop, and then the doctor is looking at it. The symptoms that are most associated with serotonin deficit is the irritability factor, the panic factor, the anxiety, sleep disturbances. And so if those are part of the equation, the doctor most likely will prescribe you the number one class of antidepressants prescribed, and those are SSRIs. Now, after that serotonin binds onto the receptor, if you see in the left, you see an arrow going back up through a reuptake channel. That's a vacuum cleaner to help bring that serotonin back into the releasing neuron so it can be used again. You can save 1 million ATP molecules that way. The body wants to be able to save its resources. But these drugs do not help you to make more serotonin. They also don't help you to build up more receptors. Both of those might be a lot more helpful. So since the drugs don't do that, how are they getting you to have more serotonin synaptic activity? Notice the diagram on the right, that SSRI is going into that reuptake channel and plugging the channel. We might better call them vacuum cleaner pluggers. So how does that work? Notice how much more serotonin is in the synaptic area when it doesn't get vacuumed back up. But also notice how much less serotonin is in the neuron where that vacuuming is supposed to take place. So these drugs will help you for about 5 or 6 months to have more serotonin activity, but now you're going to be shorting the neuron of the very substance that was already short in. And that's why you have to, when you're prescribed these drugs, you have to continue to see your doctor. You've got to get higher doses eventually. You've got to get more medicines on board, et cetera. And often these individuals have never been asked or never had a workup as to why they were not making enough serotonin to begin with. And if we could figure that out, then we can solve the problem instead of just plugging vacuum cleaners. By the way, the drug companies do not call them vacuum cleaner pluggers. What does SSRI stand for? Selective serotonin reuptake inhibitor. And so that's a much more sophisticated name. The average layperson has no idea what that means other than it's helping their serotonin levels. But once you break it down, once you understand what it is, it's just plugging the vacuum cleaners that are putting the serotonin back in there. So Nature magazine did a recent entire article on depression. And they said in a study conducted in real clinical settings, a common antidepressant produced a response in just under half of the participants and achieved full remission in only what? 28%. What does that tell you? If you run a community depression and anxiety recovery program in Fallbrook, the people that will come there will have over double the response just through mental health education than what you would have on these medicines. 5 decades of work on antidepressant drugs have not made them more likely to lift people out of depression. Medications and psychotherapies help some people with the disease, but do what? Fail many others. And of course, if it helps, we want to know which one helped, et cetera. That'll help us to know a little bit about the brain chemistry. Now, back in the 90s, when I was doing a lot of internal medicine and GI, I started to notice there was more depression and anxiety than what I had seen in my own training back in the 80s. And started to become so common, I realized I needed to become an expert in it. I was also a GI doctor, and we would treat the difficult to diagnose patient. But in gastroenterology, there's quite a brain-gut connection. And about half of these referrals to us from other GI doctors and other doctors is saying, I can't figure out what's going on. Let's go to the difficult to diagnose patient doctor, Dr. Nedley. About half of those, it was actually anxiety and depression was the core reason as to why they were having gastrointestinal issues. And so I realized that I needed to become an expert. So I sat at the feet of preeminent psychiatrists. I actually rotated with them. But I noticed they would diagnose and then go straight to treatment. As an internal medicine doctor, we are trained to not diagnose someone with swollen feet with swollen foot syndrome and prescribe a diuretic for them to get rid of fluid and send them out the door. What do we do when we see a patient with swollen feet? We'd find the cause of the swollen feet. And then we're much more likely to produce a cure. The diuretic might work, but it may not work either, depending on the cause. And so I would ask them, how many causes of depression do you think there are? One of them said 8. The other one said maybe 12. But both of them said, most of the time the cause is not known. It's, that's one of the reasons why it's called endogenous depression. It seems to come from within. And so, unknown cause. So I thought, okay, let me go, since I'm not getting, quite the full comprehensive answer I'm wanting, let me do the research, because I couldn't find it anywhere else. Turns out I was the first one to actually do the research on the comprehensive causes of depression and anxiety. And we ended up finding over 100 causes of depression and anxiety. We ended up publishing our results in the American Journal of Lifestyle Medicine, and we've found that there were 10 categories of those 100 causes. And if 4 or more of these 10 categories are active, depression or anxiety disorder most often results. The more categories involved, the more severe the depression and anxiety tends to be, and finding the causes and eliminating the reversible causes can effectively help in treating depression and anxiety. So that tells us the brain is pretty resilient. It can undergo 1 category of cause, 2 categories of causes, even 3 categories of causes. But once that 4th category occurs, that's when we're going to be tipped over the edge. That's when we're going to start losing our edge and function in a number of different areas. So let's get into the 10 categories. We'll see how many we can address here today. Genetics. This is not something that you and I can do much about. That had to do with our parents and mutations. And by the way, our genetic code is deteriorating. This is one of the things that is hard for the Darwin evolutionists to explain, because Darwinism was based on us getting better over time. But Dr. Sanford, one of the top geneticists in the nation, and now it's agreed on by all the geneticists, our genetic code does not improve one generation after another. We actually give 300 to 500 new mutations to our offspring that we ourselves did not have. And so the genetic code is deteriorating. This is why but interestingly, the genetic code, even though there's bad genes, those bad genes do not have to be expressed if we are on a good diet and lifestyle. And so that's the area that we call epigenetics. So when people come to our program, we not only see what genes are there, but if they're active. It's an area called epigenetics, and it's very useful. And this is one of the reasons why depression and anxiety tends to run in families. You can get depression and anxiety even with perfect genes, however, if you have the other categories operative. But if you have the genetic category operative, you only have 3 other categories before you get there. So it's even more important that you're on a good diet and lifestyle. One of the most common genetic issues tends to come with some personalities, being obsessive or controlling. These individuals, if you don't know them and you just meet them, they seem to be very calm on the outside. But once you get to know them, you realize they're pretty tense on the inside. They tend to be pretty competitive as well. tend to ruminate. Things happen, they'll think about it over and over again, and this is the gene that's also associated with addiction. So people tend to fall into more addictions. The gene for alcoholism, for instance, is this undermethylation gene. And the SSRIs can actually help them for a while, as long as they can tolerate side effects. But there are things that can work as well as medicine without the side effects. One of those is light therapy. And just being exposed to the frequency of the blue sky light first thing in the morning for 30 minutes or more, and you can start to methylate better. You can actually start to make more serotonin. Cognitive behavioral therapy has also been shown to help, and we've had individuals come to our program that say, Dr. Nedley, I'm here because you're the brain biochemistry expert. I've tried to research everything on the internet. I've tried this, I've tried that, all of this, and now I just want you to tell me what to do. But I don't need to go to counseling because my problems are real. Well, interestingly, if we are not handling stress well, we make less serotonin. And if we make less serotonin, we're more irritable and we don't handle stress as well. So one of the ways of changing brain chemistry is to help us to raise our frustration tolerance. And that requires some cognitive behavioral therapy to think about things more rationally and don't get to the point of the I can't stand it-itis. You know, there's a lot of individuals that think they can't stand this and they can't stand that. And there's only one thing a human being cannot stand, and that's what leads to death. But everything else they can stand. But when they tell themselves they can't stand it, they're going to actually start decreasing their own ability to make serotonin. So this is something that a lot of people are not aware of. CBT actually changes brain chemistry. But there's other things that can play a role. Folate, if you don't have enough folate. The U.S. government has targeted folate as being undersupplied in a great percentage of Americans. Why? Because they're not eating enough plant foods that are high in foliage. That's where we get the word folate from, those leafy greens. A lot of Americans pass that section up in the grocery store. They don't like the legumes either that tend to be high in it. But you can see B12 can play a role in this as well, and other factors can play a role, and this S-adenosylmethionine there, that provides the final methyl group for making dopamine, 5-hydroxytryptamine, which is serotonin, and the NE stands for norepinephrine. All three of those are critically important to optimize if you have depression or anxiety. So the treatment for undermethylation, the best treatment, and this has been well proven now in the scientific literature, is not pharmaceuticals. It's actually lifestyle, nutritional changes, and potentially adding supplements. S-adenosylmethionine is a supplement that can actually fix the genetic defect. Saffron is also a supplement that helps it. If you're low in calcium and magnesium, that can be helpful, or if you're short in B12. So, and of course, if you're not methylating well, you're not going to make melatonin well at night as well either. SAMe has now had 115 clinical trials. Many randomized controlled trials show high doses to be helpful in treating depression. It's also effective to augment and improve the effects of antidepressants, so it can be an add-on. It's not an either-or. You can actually utilize SAMe with medicine. And SAMe will actually improve your sexual dysfunction, while SSRIs will decrease your sexual function. The SSRIs are associated with weight gain. They tend to worsen impulsivity. That's one of the reasons. The tolerability effects are similar to placebo. So it also helps memory. It can even help osteoarthritis, can help fibromyalgia, and has even been shown to be helpful in Parkinson's disease as well. Saffron is those little red stems, and unfortunately, it's an expensive spice. Sammy is pretty expensive as well. There have been 7 randomized controlled trials and found that it was as effective as traditional antidepressants, but once again, without any reports of the serious adverse effects that the antidepressants can cause. It was as effective as Prozac as well in a comparison of 8 randomized controlled trials, and saffron, unlike the SSRIs, improved memory and improved premenstrual effects as well. In fact, a little bit more about that in regards to memory. But these supplemental things can take a little time to work, 4 to 6 weeks, as you can see, and that's really how medicines work as well. They don't help you right away when you start taking antidepressants. Saffron, 30 milligrams daily, equivalent to Prozac. Again, no sexual side effects. Even smelling it helps. And this was a pretty amazing study. Worked as well as the leading drug in treating Alzheimer's without the side effects. And so it actually seems to decrease the amyloid beta protein development as well. Now, this study was just published. I don't know if you can see the date on it, but it was just published in May of this year, 2025. You can see when it was received by Psychological Medicine and them working on it and accepted for publication in April, but it wasn't published until May. And it looked at 192 randomized controlled trials in a network meta-analysis of nutraceuticals. What are nutraceuticals? Those aren't pharmaceuticals, those are natural supplements for depression and anxiety. Now, for years, the medical establishment has criticized nutrition and lifestyle measures because they don't have placebo-controlled, double-blinded, randomized controlled trials. Now, for a pharmaceutical agent, you better have a placebo-controlled, randomized, double-blind trial. Why? Because pharmaceuticals are going to be foreign substances. They're not natural, the body is not used to them, and you better look for side effects, and you better look for effects, and look at all of those things. And so that's why we have the standard of randomized controlled trials. But, for instance, blueberries that have been shown to be helpful, the doctor might criticize it. Well, yeah, that study showed blueberries were helpful, but where is the randomized controlled trial? Well, how can you have a placebo that looks like a blueberry, tastes like a blueberry, and you can't tell it any difference from a blueberry? No one has been able to make a placebo, that does that. Also, physical exercise. They'll criticize, well, yeah, exercise seemed to help in that trial, but where was the randomized placebo-controlled trial? How can you make a person think that they're exercising and taking the time to do that when they're not exercising and compare that? And so they actually make a standard that's for pharmaceuticals and try to apply it to natural lifestyle principles. And you can never do that, but yet science can still show us a lot of benefit without having to do randomized controlled trials. But when it comes to nutraceuticals, you can actually do randomized controlled trials. Why aren't there very many of them done? Because they're expensive. Randomized controlled trial is normally going to take you $1 million. Why do pharmacology companies are willing to invest in that? Because if they can patent that, they're going to make a lot of money if its effects outweigh the benefits. But when you have a natural substance, you pay $1 million and you can't patent it. Everyone else can actually extract it and use it as well. And so there's very little motivation to spend money on this. But yet, to date, and it's been very nice in the last few years, There are those that have actually pooled resources and done over 192 randomized controlled trials on nutraceuticals. And you can see, I don't know if you can necessarily read that at the bottom, but if you read the results, they will show you that the nutraceuticals actually outperform the antidepressants, some of them. And they certainly help the antidepressants when they used them with the antidepressants, some more than others. So treating depressive disorders indicated a number of pharmaceuticals that could offer benefits, either as adjuncts or as monotherapies, says the conclusion of this large meta-analysis. So the argument that natural substances, there isn't the evidence, is gone. And so this is very clear. And interestingly, two of those, there were a multiple that did better than antidepressants. Two of those that did better were SAMe and saffron, the two that I've just mentioned. And they're helping to actually help the genetic defect in individuals with undermethylation. Adverse childhood experiences is also a whole category of causes that, along with other causes, can bring about depression and anxiety. We call these developmental causes, when the brain is being developed. And I'll just give you one example. There are many examples of adverse childhood experiences. There's abuse, there's neglect. If you have a parent that's an addict, an alcoholic, or meth addict, et cetera, that's an adverse childhood experience. That's going to play a role in regards to your development. By the way, there's 10 different categories of adverse childhood experiences as well. And so we get a lot of individuals coming to our program. One of our employees that works for us, terrible shape, multiple suicidal attempts. But when you hear her story on adverse childhood experiences, she actually experienced all 10 categories by the time she was 16. And you might imagine what a rough and sad life she was living until she found out about our program. I walked into her room after another suicide attempt to stabilize her. I work 3 days a month at a hospital. I used to work, of course, almost every day at a hospital, but now I'm an administrator and do other things. So I'm only doing it 3 days a month to keep my skills up. But I walked in and her husband was saying, she's been to psych wards. She's been through all of this. Yeah, she had adverse childhood experiences, but she's got me. We've got a good income. We've got good kids. I don't understand what's going on, and I don't know how to get her help. We are at our wits' end. Do you know of anything that could help us? I said, well, yeah, this would be a different approach, but I gave the number. I didn't say it was the Nedley Depression and Anxiety Recovery Program because I was working on saving her from what she had done to try to end her life. But that day they were on the phone with our screeners, and the hospital allowed her to be discharged directly into our program instead of going to another psych ward, since that obviously hadn't worked before. And her life totally changed. So even if you have 10 adverse childhood experiences, you can completely recover. And she's an encouragement to our other participants because of how her life has been transformed. And so adverse childhood experiences don't have to necessarily define you. But one of the adverse childhood experiences that is greatly increasing in our society today, the sexual revolution has produced its sexual complications. When I started the residential program in the early 2000s, there was 1 in 10 females that were sexually abused by the time they were 18, 1 in 100 boys. But with the sexual revolution and the changes that have taken place, it's now 1 out of 4 chance a female will be sexually abused by the time she's 18. And even greater than 1 out of 4 for males now to be sexually abused. So we're seeing sexual abuse at an all-time high, and it has complications. It increases your risk of depression, anxiety, suicidal ideation, suicide attempts, alcohol dependency, illicit drug dependence, young sexual encounters. And every one of those things were present in this girl that I just told you about, with those 10 different categories, every one of them. But by age 30, they're going to have PTSD, decreased self-worth, decreased life satisfaction. They're going to need more doctor visits. They will have had more sexual partners. They're going to be far more likely to be a welfare recipient. And the biggest statistical difference is decrease in life satisfaction. This is why there should be a complete moratorium on sexual abuse of children. But I can tell you, in the age of sexual freedom, when you read some of these progressive statements from these organizations that talk about sexual freedom being at the core of our Constitution and liberties and why we need to have sexual freedom everywhere, there's people that are called minor attracted people, etc., and they're saying as long as it's consensual, it should be okay. And so children should be able to experience this too if they consent with an adult, etc. And it's why California doesn't even call you a sex offender if it was statutory rape and the girl was 14 or 15 or whatever anymore. But this has produced problems. I don't think we can cover it up. This has produced problems, and I think our country needs to wake up. If you're working in an emergency room today, one of the areas that you're not going to hear about is the sexual abuse of young boys. They're going to be there, and they're going to be injured, and they're going to be in the emergency department, all of that, and that happens every day in every ER department, and they're discharged and go out the door after they're repaired or whatever, and the media doesn't pick up on any of those things. It's not written up in the newspaper. It's not written up as whatever, but I can tell you it's happening. I work in ERs, and I see it. So when you have adverse childhood experiences like that, you're going to have some attachment disorders along with it. You're going to have some filters of how you view the world. And this is why the counseling aspect is critically important, to have loving, compassionate counselors that can help individuals to be able to view life rationally despite the trauma that they've had. Lifestyle causes: lack of physical fitness, lack of fresh air and light. There's advantages of exercising, particularly outdoors. You see this man exercising in a forest there. The Japanese discovered forest bathing. If you're out exercising in a forest, the additional advantage is not only the fresh air, not only the oxygen, but you actually are breathing in essential oils that are being released by the leaves of the tree that can have an antidepressant effect. And there's a whole host of essential oils now that's been shown, even them in randomized controlled trials, producing a benefit. One of those, fortunately for Weimar, being on the foothills of the Sierras, is pine needle extract. Just breathing that mountain pine needle aroma can actually help in regards to mood and help you have more rational thinking. Several lines of research suggest exercise increases brain serotonin levels and activity in the hippocampus and frontal lobe in the human brain. Increase in the brain of serotonin precursor tryptophan that persists after exercise. Most of the tryptophan you eat does not get into your brain. It needs a carrier to get it across, and it needs insulin sensitivity. The exercise helps with the insulin sensitivity. Large body of evidence supports the idea that exercise, including exercising how? to fatigue. It's kind of a novel concept. There's a lot of people want to exercise, but they don't want to get fatigued. Exercising to fatigue is associated with an increase in plasma tryptophan, a decrease in the plasma level of the branched-chain amino acids that compete with tryptophan to come across the blood-brain barrier, and they inhibit tryptophan transport into the brain. So exercise will also help you have the raw ingredient there in your neuron for the manufacturing plant to be able to put that into serotonin. So physical fitness is actually better for your brain than it is your body. It is good for your body, but it's even better for your brain. And if you're getting fit through outdoor exercise, you're even getting a lot more benefit. And that doesn't cost a gym membership either. Circadian rhythm causes. Screens in the evening throw off your circadian rhythm. This is well documented. If you're looking at screens an hour before bedtime, you're going to delay your melatonin output. You might even decrease it by the half of what would be produced otherwise if you weren't on a screen before going to bed. Reading printed books does not do this. So whatever your scheduled bedtime, it's actually good to go to bed on time and to quit using your screens at least an hour before going to bed. And the best circadian rhythm for serotonin and melatonin production is early to bed, early to rise. How do we fix people's circadian rhythm? Most people that come to our program, they don't have regular bedtimes. They don't have regular wake times. They don't have regular meal times. This is not healthy for the brain. The brain likes that regularity. So the best thing that we can do to set the regularity is expose them to light therapy. We actually have these little light glasses that emit the blue sky. So even in the wintertime, they can have that 5:30 a.m. light, and if they have that for 30 minutes, after 7 days, their circadian rhythm is set. They're now ready to go to bed and sleep, and they wake up with a lot more energy. Light therapy has been shown to increase serotonin synthesis, improve mood, and also improve social interaction as well. Then there are addiction causes. Addiction is at an all-time high, in part due to the addiction that's being demonstrated here. This is now the #1 addiction known to mankind: technology usage. And whatever your addiction is, it's going to lower your dopamine set point. When we are doing things like watching YouTube videos that are funny, it seems great to do at the time, but we're actually picking off dopamine receptors as a result of that dopamine surge. And dopamine receptors will decline with alcohol, cocaine, meth, marijuana, casual sex. There's a couple of reasons for that in regards to casual sex. You're not getting the oxytocin. You don't have that bonding chemical. And you also don't make prolactin, which actually helps protect the dopamine receptors. And so even sex with yourself, which is becoming very common, will pick off dopamine receptors, cause that dopamine set point to go down, and cause significant issues. Even marital sex that is too frequent or the wrong type also will not have that protective effect. Unhealthy food. By the way, anyone want to know the top 5 addictive foods to Americans? This was a recent study. Number 5, ice cream. Number 4, cookies. Number 3, chips. Yes. Number 3 is chips. Number 2, chocolate. And number 1, cheese pizza. What do those things have in common? Fat, salt, and most of them have sugar as well. And this can also start picking off dopamine receptors. Now, fortunately, those dopamine receptors can come back. If you have a food addiction, it's a powerful food addiction. Studies show it takes 4 months of not utilizing that food till your dopamine receptors come back to the way they would have been without being on that. So if you've got a sugar addiction, stay away from sugar for 4 months. You will notice some great brain changes after that. And you'll notice your motivation improving, your energy, your memory, those sorts of things. Entertainment, TV, and movies can also be addictive. They're frontal lobe suppressants, entertainment, YouTube, the usual use of social media. Our country is making some big mistakes regarding marijuana. This whole cover-up campaign in regards to the dangers of marijuana is real, but it's not been able to last, and there's a whole host of studies now showing the issues with marijuana. Increases psychosis risk significantly, increases paranoia. If you have the gene for psychosis, one use of marijuana can set you over to become a schizophrenic or a bipolar 1 patient for life. This is why no one should be selling recreational marijuana to anybody unless they have gotten the $650 confirmation of the genetic test that they don't have the gene for schizophrenia. But the marijuana users wouldn't make money if they had to do that, so they'll just subject them. Oh yes, this will help you. You'll like this. Repeated marijuana use has been shown to lower IQ permanently, and it also lowers your motivation and enjoyment of usual pleasures, and it lowers emotional intelligence significantly. Now, what the world seems to be very ignorant of, they know that cannabis, quotes, cannabis is healthy, so let's just use marijuana products that have the THC taken out. But you can't get all the THC out. And these so-called just CBD, we check the urine test, and the urine test lights up with THC. And the marijuana that's grown has a lot more THC than what it used to have. And the cannabis from marijuana, thus, is not danger-free. It's not risk-free. But there are other cannabinoids out there that have no THC. And they're so they can have all the benefits of marijuana with none of the risks. And they're a lot cheaper. Here's one of them, Selexon. What is Selexon? It comes from the oil of the lavender plant. Significant anti-anxiety relieving properties without sedation, without addiction, without frontal lobe suppression, without paranoia, without lowered IQ. In fact, it'll actually increase your test scores if you have test anxiety. Now also found to be an antidepressant, increases serotonin release and extracellular brain serotonin levels. 80 milligrams daily, relief of generalized anxiety disorder in 76% of patients with over double the improvement compared to placebo, and far better than any marijuana product has been shown to have. But you go to a recreational marijuana store, they won't have any of that. Not going to be there. And it'll also improve your sleep quality. And they even compared it to lorazepam, Ativan. This is a very addictive frontal lobe suppressant that many people are using for anxiety. 6-week trial showed an improved anxiolytic effect, comparable improvement in sleep to lorazepam. Since lavender oil showed no sedative effects in our study and has no potential for drug abuse, Selexon appears to be an effective and well-tolerated alternative to benzos for amelioration of anxiety. How can we get dopamine receptors to go up? Outdoor physical exercise, forest bathing, the 3 months of no PMO. What does that stand for? PMO stands for pornography, masturbation, orgasm. This is even getting popular in Hollywood. The 90-day sex fast. It will replenish your brain if you've had sexual issues as one of the reasons why your dopamine receptors are down. Healthy friendships, live social interaction, learning new things. Studies have shown even learning from the Bible has a nice dopamine response that's not a surge, but the dopamine level is far above neutral and will last for hours after the Bible study. And so this is another natural, healthy way. Well, we'll end on nutrition. I won't make it through all of the hits. Diet is as important to psychiatry as it is to cardiology, gastroenterology, and endocrinology. That's not my statement. That is the statement of a prestigious European psychiatric journal after reviewing the peer-reviewed medical literature on what nutrition can do for the brain. In fact, they go on to say nutritional medicine should now be considered as a what? Mainstream element of psychiatric practice. So if your doctor is not asking you about what you're eating, if he's not asking about nutrition or telling you about nutrition, he is old school. He is not mainstream. They go on to say, now is the time for the recognition of the importance of what? Nutrition and what else? Nutrient supplementation in psychiatry. So there have been studies that have shown that if you take the antioxidant vitamins A, C, and E, in 6 weeks you will have a clinical response in depression and anxiety. So why is it when people come to our program that we don't immediately put them on A, C, and E? The reason is the power of whole plant foods. Eating plant foods in their whole form provide great nutritional benefits. Plant foods exceed their component parts. 1 cup of cooked kale has 50 milligrams of vitamin C and 13 units of vitamin E. That's a very potent plant food with that much C and E. But notice the antioxidant potential of that 1 cup of kale. It's equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. So we will feed them kale when they come to our program, and we won't put them on A, C, and E. But the benefits of antioxidants, they reduce the breakdown of neurotransmitters, they increase serotonin and dopamine concentrations. They're also helpful for women in menopause, particularly the isoflavones, and the Human Nutrition Laboratory recently looked at the top 10 antioxidant American vegetables. They're from Baltimore, Maryland. Number 10 was eggplant. By the way, eggplant has a molecule that other foods don't have called acetylcholine. And acetylcholine will lower your blood pressure. Just 1,200 milligrams of eggplant extract twice a day will lower your blood pressure as good as a blood pressure medicine. But it also is going to help your mental health. Corn is number 9. Onions, 8, red bell pepper, 7. Beets are a humble fruit, but loaded with antioxidants, and beet powder will also lower your blood pressure. Number 5 is broccoli. Number 4, Brussels sprouts, even more potent than broccoli. Number 3 is spinach. Number 2 is kale. And what is the number 1 antioxidant vegetable? It is indeed garlic. The advantage I have of being married to a Romanian is every entree starts out with 4 cloves of garlic. The top 10 antioxidant fruits, grapefruit is number 10. Now, by the way, you might have been cautioned against grapefruit because it can interact with your medicine. Does anyone know how grapefruit interacts with your medicine? It actually helps you to absorb more of the medicine. It's loosening the tight junction. So the average medication, you're only absorbing about 20% of what's in there. And the doctors all know that, and so they're dosing that way. But if you ate grapefruit, you might absorb 60% of it. It might triple the dose. So if your doctor wants you to go up on the dose, you might save money just by eating grapefruit with it, and you'll go up on the dose. But just be aware that that's one of those effects so that you're aware of it. But it is a potent antioxidant fruit. Kiwi is number 9, cherries number 8, red grapes number 7, oranges number 6. By the way, there's a recent study on oranges showing that they also improve serotonin levels. And it's interesting, what season do we have the most challenge making enough serotonin? It's in the wintertime. And when did God have the oranges ripe and ready to eat? He kind of seemed to know that we might have some issues in the winter, so those oranges are ready in the wintertime. Number 5, even more potent than oranges, are plums, humble fruit, but loaded with antioxidants. The top 4 all are a part of one family. Raspberries, number 4. Strawberries, number 3. Blackberries, number 2. And I think you know what number 1 is. We mentioned it earlier, blueberries. Let's see. There's only one diet that's been shown improvement in depression in a randomized controlled trial where the benefits start within 2 weeks, and that's actually a plant-based diet. Sometimes people wonder, well, I'm coming to this program for depression and they're just feeding me plant-based foods. Dr. Nedley biased or something? I think he's just cherry-picking from the scientific literature. You can't cherry-pick when there's only one cherry. And no other diet, and they've tried a whole host of them, no other diet's been able to show a benefit in depression and anxiety in as little as 2 weeks. Now, you might have heard of the Mediterranean diet. It took 3 months for that to show a benefit, but it wasn't near as beneficial as the plant-based diet. The advantages of it is no arachidonic acid, no cholesterol, higher in antioxidants, and better tryptophan uptake. I also want to mention, as we're speaking of nutrition, omega-3. This is an anti-inflammatory food. There's many people that are deficient in omega-3. By the way, this is one of the supplements, not fish-based omega-3, but algae or plant-based omega-3 was shown to be superior to any antidepressant on the planet in those randomized controlled nutraceutical trials. Vitamin C is also beneficial. So the plant foods that are highest in it, you can see many people have known that spinach is high in omega-3, which it is. But notice one avocado has more than a cup of spinach. Fortunately for this area, it grows a lot of avocados. Navy beans higher than avocados. Kale is higher than navy beans. So kale is also high in omega-3. Edamame, your mature soy is high in omega-6. The edamame is your green soy, and that's high in omega-3. Red bell peppers are high. Tofu is a pretty good source, and the top 4 are hemp, walnuts, chia, and the highest source is flaxseed. And then if we can get vitamin C, that's also beneficial. These are the foods high in vitamin C. You can see red bell pepper is a very high in vitamin C, higher than even oranges or papaya. Sweet yellow pepper is even higher than the red bell peppers for vitamin C. One pomelo has even more, guavas have even more, and the highest by far per cup are the acerola cherries. So this is just some of many. Tomorrow night, we're going to go through some of the latest studies just in the last year on nutrition and lifestyle and other measures that have been shown to be highly effective in treating depression. But if you are treating it according to how we mentioned it today, you will be doing far better than what the pharmaceutical agents can do. But don't think that it's an either-or situation. We can always add on these things to antidepressants if we're on them, and that can give you a better chance of getting off of them as well. I also wanted to mention the frontal lobe of the brain. One of the things that's critically important is to be thinking positive thoughts, and the typical depressed person, 80% of their thoughts are negative, 95% of them are repetitive. But one of the things that can start switching our negativity to positivity is what Paul advised when he said, set your affections on what? Things above, not on things of the earth or earthly things. And that can also help our serotonin levels. So any questions about what we've presented here tonight? Yes. Yeah, no, good question. If you have an addiction, it's going to be to, I mean, maple syrup also has sugar, even though it's, it's very, very similar. Honey, of course, would also be in that category. So if you're a sugar addict, and not everyone is a sugar addict. I mean, if you can, low amounts of sugar and you don't have a predilection to continue to eat more, or you're not obese, or you're not having problems due to excess sugar, we don't tell everyone to be on a no sugar diet. But if you have a sugar addiction, my father was one of those. I saw him change his life at age 13. My mother thought he'd never get off of sugar because he was addicted. Ice cream, root beer floats, chocolate-covered cherries, Reese's peanut butter cups, Toll House cookies. His waistline was expanding. He was having health issues, and then he read a book called Sugar Blues. And his life changed completely when he got off of sugar. It took about 4 months, but his enjoyment for natural foods went up tremendously after those dopamine set points came back up again. And my uncle said it was just worthwhile to see my dad eat. Coming up from Texas, I'd just like to come up here to see this man enjoy natural foods. He just has this smile on his face and enjoying food right out of the garden. And he didn't have that enjoyment before when he had that. But in his case, he left it all out and never went back to it again. In fact, if he had sugar, it didn't taste good anymore. It was a sickening sweet to him. And that's how you know you've gained the victory, when the food that you used to eat you had an addiction to, but now you don't even like it. Yeah. Yeah, that's true. You can even have corn syrup added to your honey. But we don't want to have too much. Even Proverbs says it's not good to eat too much honey. Yes, question.
Connection between migraine headaches and depression. Can you explain a little bit?
There is a connection, strong connection, that's been well shown. And we've had many individuals have their migraine solved once their depression is solved. There also can be some biochemical effects. Now, migraines are often due to inflammation of the brain, and the inflammation of the brain can also produce depression and anxiety. So if we can get that inflammation of the brain go down, that can be helpful. But also it could be due to one of the areas I didn't talk about tonight were toxins. And one of the toxins that we have found that's associated with migraines and headaches is excess free copper in the system. And we'll actually take care of that with zinc and B6, and that can be very transformative for a migraine sufferer as well. So we'll look for the cause, but there's often a similar cause bringing about both. Yes, question over here, but wait for the microphone so the online audience can hear.
Okay, is RFK Jr. On board with this?
So, RFK Jr.
I'm not questioning it. I'm saying, is he going to come out in favor of it?
Yeah, well, I don't know that RFK Jr. knows about our research and data, but in general, he is definitely for more natural approaches to treating disease and preventing disease. And he's figured that part out. And so I would think he'd generally be more in favor of approaches like this. Well, you've been a very attentive audience. We have one more.
Those fruits that you mentioned have a lot of sugar in them. I know they have fiber, but you can't eliminate sugar, can you?
No, I'm not talking about eliminating sugar from particularly northern fruits. Now, the berries don't have as much, but northern fruits in general are definitely healthier and easier to tolerate if you have diabetes or if you have insulin resistance or those sorts of things. So normally we'll have them avoid mangoes, pineapples. Grapes can act like a tropical fruit as well. So we'll be eliminating the foods that the fruits that are more just almost pure sugar. But the other fruits are actually quite beneficial when it comes to overall brain health in most individuals. All right, well, you've been a very attentive group, and we look forward to seeing you tomorrow and tomorrow evening as well. Thank you.
Thank you for coming tonight. I just want to say that tomorrow morning, for those of you who are guests, at 11 o'clock for our regular church service, Dr. Nedley will be presenting at that time. And then tomorrow evening at 7 o'clock back, he will be completing his 3-part series. So I want to make sure that you all know that we're going to be here. Tomorrow morning, it'll be there'll be a few more people here, so you want to make sure you get here early so you can find a seat. But again, I thank you for coming. How many of you learned something tonight that's going to be valuable to you? All right, wonderful. Well, we hope that continues tomorrow. And again, blessings to you as you go home this evening, and we hope to see you back tomorrow. God bless. Thank you.